Hello everyone, my name is Kayla Hersey and today I will be presenting a Community Health Needs Assessment for Providence, Rhode Island. What is a Community Health Needs Assessment? As defined by the CDC, a Community Health Needs Assessment refers to a state, tribal, local, or territorial health assessment that identifies key health needs and issues through systematic, comprehensive data collection and analysis. In order to conduct a community health needs assessment, we must use logic models as a method to collect important information and data that is tailored towards identifying a community and their particular health issues and needs. The Precede-Proceed model is one that was first developed for use in the public health field. Historically, health interventions were developed using this model. However, it was discovered that this information could be applicable to community matters as well. The Precede portion of the model is the diagnostic portion of the program planning, as it works towards identifying an issue. One of the unique and positive qualities of this model is that it works backwards towards change. A desired outcome is identified and then an intervention is established by working backwards to promote change. There are 4 phases of the Precede model that are used to construct a community health needs assessment. During phase 1 of this model, the community and its needs are identified, making the community the focus starting point. Once this is identified, you then work towards identifying the health issues that are preventing the community from living their best life. Phase 3 and 4 then focus on what is needed in order to create a positive outcome and promote an intervention. Due to the construction of this model, it can be used not only on a one-time intervention basis, but also a decade-long intervention, making this model more appealing towards a community health needs assessment. Lastly, the community plays a very large role in this model, therefore they are involved directly in the outcomes rather than public health officials assuming what the community wants or needs. Another model that is useful towards creating a community health needs assessment is the MAP-IT model. This model stands for Mobilize, Assess, Plan, Implement, and Track. MAP-IT was adapted from Healthy People 2020 in order to promote and plan health interventions. The goal of this model is to create a healthy community. Much like the Precede model, this model is also community-centered, making it beneficial towards completing a community health needs assessment. Another positive of this model is that it works towards engaging stakeholders and organizations, which play a huge role in the community. In addition, this model also creates a specific plan with goals that are clearly identified and responsibilities are outlined. One portion of this model that is beneficial over the Precede model is that it leaves room for adjustment when necessary. The major con of this model is that it is more useful when wishing to implement a change, rather than to just assess the information that is collected. Only the first portion of this model is designed towards identifying an issue, while in the Precede model you work backwards towards honing in on an issue and addressing it via a desired outcome. The largest portion of the MAP-IT model that is used for a community health assessment will be the first two steps, mobilize and assess. These portions of the model will help identify a community, its needs, and all of the gathering of data on the health issue that is identified in a particular community. The chosen community for this health needs assessment is Providence, Rhode Island. As of July 2016, the population of Providence is nearly 200,000 people. Providence is the capital of the state of Rhode Island and has the largest population. It is considered one of the oldest states in the U.S. as it was founded in 1636 by Roger Williams. It is primarily known for its textile manufacturing, machine industries, as well as jewelry production. Providence is broken up into 4 areas known as North Providence, South Providence, East Providence, as well as Center City, Providence, with 25 official neighborhoods. Those aged 6 to 18 make up 22% of the population, while those under 5 make up 6%, and those 65 and older make up 9%. The population of Providence is diverse. 51% are white, 41% Hispanic or Latino, following with 5% Black or African American. Also, 28% of the population is considered foreign-born. Socioeconomic issues for the community of Providence are centered around money. The average income per household in Providence is $37,000 as compared to the state's level of $58,000. 28.2% of the population is living in poverty, as compared to the state's level of 12.8%. 68% of those who are 16 years and older are in the labor workforce. In regards to housing, owner-occupied housing makes up 63.6% of the housing units in Providence. The average cost for rent is $949 as compared to the state's rate of $938, and the average mortgage in Providence is $1,491. Major areas that are discovered to be health issues for the members of the state of Rhode Island of Providence include access to care, asthma, cancer, weight, and mental health. This information was gathered via a community health assessment and survey data done by Rhode Island Hospital. This data was collected via community health surveys, the U.S. Census Bureau, Rhode Island Hospital data, as well as from stakeholders. This data shows that the levels of these major health issues for the community in comparison to the United States and surrounding states of Massachusetts and Connecticut. Access to care is a major issue in Providence. This data is further broken down into insurance status as well as cost of seeing a doctor and the number of primary care physician to patient ratios. Without insurance, one may not be able to afford seeing the doctor, or they may have very high copays which prevent them from visiting the doctor regularly. In addition, the number of patient-to-doctor ratios is high, which may prevent patients from being able to get an appointment in a reasonable enough time. Asthma is another issue for Providence, with 17.6% of adults having the condition. Third is cancer rates, which are highest in Providence in comparison to the U.S., Mass, Connecticut, and Rhode Island. Specifically, breast and prostate cancer are the highest. Next, the fourth major health problem per reports is weight and obesity levels. The percentage of overweight individuals is similar in all 5 of the compared locations at about 35%. While there is no major difference for all these communities, the obesity and overweight levels are a public health crisis everywhere, contribute to the health of an individual, and are noted by the community to be an issue. Lastly, mental health was reported as a 5th major health problem in the community. Data available for Providence shows that the mortality rates of suicide is 11.8 per 100,000, which is nearly the same for the other communities. These major health issues align with many of the leading health indicators by Healthy People 2020, such as access to care, weight, and mental health. Cancer and asthma levels are not clearly identified in the leading health indicators by Healthy People 2020, but can be considered as consequences of some health indicators such as air quality and clinical preventative services. Based on the presented data, the chosen priority health issue that is identified in Providence is access to care. Access to care can be defined as the ease with which an individual can obtain needed medical services. One is considered to have appropriate access to care when they are immersed in the healthcare system, can receive their needs from a healthcare site, and when specialized providers are easily accessible to those in need. It is important to know that access to care does not only include health insurance coverage, but also the accessibility of using coverage or services provided. Not only is this an issue in Providence, but an issue nationally. Dr. Lori Diallo, a professor and researcher in the community, has also identified access to care as a major health issue in the community. Specifically, she reports that access to care in dementia patients is limited. She explains that there are 23,000 people in the state of Rhode Island that are living with Alzheimer's disease, yet there are only 3 neurologists who specialize in this disease. Individuals have to wait anywhere from 6 to 9 months for an initial appointment. Typically, she describes that the neurologist will order tests to properly assess the patient, but many times these tests are denied by insurance companies, and therefore the patients are not receiving proper diagnostic tools. Dr. Diallo also explains that once these tests are denied, many patients are not following up with their physicians and therefore are considered lost to follow-up, a prime example of an issue with access to care. Risk factors for lack of access to care in Providence include socioeconomic status, race or ethnicity, poor health, gender, age, as well as smoking status. Socioeconomic status is defined as the social standing or class of an individual or group. It is often measured as a combination of education, income, and occupation. The U.S. Census reports that those who are uninsured are individuals with a high school degree or less, and those who are working but living in poverty, therefore representing a lower socioeconomic status. Additional data reports that an individual's race and ethnicity is also contributable to access to health care. In Providence specifically, Hispanics fell at the highest level of uninsured as opposed to non-Hispanic whites and African Americans. In addition, Hispanics were the highest race to lack a doctor, inability to afford a doctor, as well as reporting to not have a checkup in the last 12 months. In terms of poor health, individuals in Providence, Rhode Island are more likely to report having poor health when they are uninsured, do not have a doctor, cannot afford a doctor, and have not had a checkup in the last 12 months. The largest age group in Providence that is affected by access to care are those 18 to 34. Men are also more likely to have reduced access to care when comparing to women. Those who report that they smoke are also more likely to have reduced access to health care among the aforementioned categories. In order to combat this issue, there are many organizations designed to help. For example, the Rhode Island Foundation has developed targeted goals for 2025, which include improving the number of adults that have a yearly checkup to 90%, paying healthcare dollars through alternative methods, and reducing health status disparity by 50%. In addition, the Rhode Island Free Clinic located in Providence offers free healthcare to those ages 19 to 64. There is also a specialized clinic which targets Hispanics in Providence, which is known as Clinica Esperanza. This clinic also offers free preventative health care screenings and exams. Lastly, access to care is also a concern for the entire nation, as there are nationwide initiatives that have improved the number of those who are uninsured and continue to work on improving access to care. Specifically, access to care has been a major goal of Healthy People 2020, a 10-year agenda with goals to improve the health of a nation. In addition, the Affordable Care Act has enforced that health insurance be obtained by all, or enforcing a penalty if there is lapse of coverage. After reviewing the socioeconomic and health status data of Providence, Rhode Island, some interesting conclusions can be made. Firstly, Providence is the most populous and diverse city in the state. However, it is important to look at the economy of Providence for a comprehensive review. The city is known to have a higher percentage of those living in poverty as compared to the state. Hand in hand with poverty comes income. As you might expect, the average income is lower in Providence as compared to the state of Rhode Island for both household and per capita rates. Evidence suggests that those that are living in poverty have a reduced income, as well as those who are of a different race and ethnicity are more likely to have reduced access to care. In Providence, many individuals are facing these barriers, and therefore access to care is now a major health issue. Individuals in Providence are more likely to not have health coverage, not see a doctor due to costs, and there's also a greater burden on patient to primary care physicians as researched by the state's local hospital. In summary, Providence is the most populous, diverse community in the state. One of the negative aspects is the lower levels of income per household capita. Following data collection, it was noted that the most significant health issues are asthma, cancer, mental health, weight, and priority health issues of access to care. Speaking in terms of access to care, only the state of Rhode Island has opened many organizations. Members of the community are able to visit these organizations regardless of age, sex, race, ethnicity, and health insurance status. In addition, Providence has also increased areas that are designated for Hispanic population, which is demonstrated throughout this assessment can be noted as important and significant members of the community. Having designated areas allows for improved access to care, which can help combat health literacy issues. While these organizations are extremely helpful, some may not know they exist or may not know they qualify. The city can work on promoting these places with local advertising or mailings so that those who live in the community are aware of what's available to them. The community should feel that they can afford care and treat their issues on a regular basis. Thank you.